There has always been some controversy in the field of addiction studies, but more recently discussions have become quite polarized, often generating more heat than light. On one side, we have those who advocate for the position that addiction is an acquired, chronic, relapsing disease of a hijacked brain. Advocates tell us that under the impact of drugs or compulsive behaviors such as gambling or internet gaming, personal choice is limited in vulnerable individuals. Drug use and behavioral actions become compulsions and are not under conscious control. Psychoactive drugs and compulsive behaviors mixed with vulnerabilities in individuals are the culprits here. There is much to recommend this view. Clearly, alcohol, nicotine, and other drugs as well as compulsive behaviors have psychoactive effects. On its face, addiction involves the brain, a chronic course, relapse, and a process that resembles abduction. The labeling of addiction as a disease relieves some of the shame and stigma felt by addicts, but it also raises a number of thorny and troubling issues. This is the current and dominant model of addiction espoused by many of our most respected addiction scientists, treatment professionals, and scholars. It is the view that guides much of our public policy and research funding. Many in the media and pop culture champion this model, but the common man or woman finds it difficult to accept at face value. On the other side is a chorus of respected scholars, treatment providers, and advocates for an opposing and vocal minority view, namely that addiction is a choice and not a disease. It is voluntary behavior akin to adopting a religious belief system or falling in love, but more harmful, a willful dedication and commitment that leads to self-destruction. This view is directly opposed to any analysis of addiction's compulsiveness that excludes an individual's sovereign choice to use. People are held accountable. This view also tends to be hostile to any kind of mutual help or 12-step engagement. Empowering the self is its mantra, not powerlessness or reliance on higher powers. This makes it controversial in addiction treatment circles that, more often than not, have some loyalty to Alcoholics Anonymous and related programs. More recently, a new perspective has emerged that builds on elements of the choice model but underlines addiction as a learned behavior. The advocates of this model emphasize that the brain is changing all the time, adapting to the living world and altering itself as circumstances demand.